God, that was a long meeting.
No kidding.
Are you okay?
What's wrong? Is he okay? What happened? Is he okay?
Are you okay? Are you okay? Call 911. Go get the AED. He's not breathing.
He's not breathing.
1, 2, 3. 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 8, 29, 30.
Here's the mask.
Patient's chest. Peel white pads from gray plastic case. Attach pads to bare skin exactly
1,
as
2,
shown.
3, 4,
Stay
5.
clear
Clear.
of
Stop
patient.
CPR.
Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the
Clear.
flashing
Everybody clear?
orange button now. Shock delivered. It is
I can
safe
take over.
to touch the patient.
1,
Begin
2, 3,
CPR.
4, 5, 6,
The AED delivered a shock. Yes, they're resuming compressions.
13, 14, 15, 16, 17, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 29,
Stay
30.
clear of patient.
Clear. Everybody clear.
Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now.
Shocking.
Shock delivered.
Wait, he's moving.
And he's breathing normally.
Thank God.
Help me get him on his side while we wait for help.
CAB stands for compressions, airway, breathing. It's the sequence of steps for CPR. You've already learned how to give compressions. Now you learn how to open the airway and give breaths. After 30 compressions, stop to open the airway. Tilt the head back and lift the chin. When an unresponsive person is lying flat on his back, the tongue relaxes and blocks the airway. Tilting the head and lifting the chin moves the tongue out of the way. At work, you will usually use a CPR barrier. Apply a CPR mask firmly to create a seal when you give breaths. With the CPR shield, pinch the nose while you give breaths. Give 2 breaths for 1 second each breath. Provide just enough air to see the chest rise. Don't give breaths too hard or fast. Resume compressions immediately after giving breaths. It should take less than 10 seconds to give 2 breaths and resume compressions. Provide cycles of 30 compressions and 2 breaths. For the purpose of CPR, an adult is anyone who has gone through puberty or has signs of puberty. If you're not sure, consider them an adult. So how do you know if someone needs CPR? A person in cardiac arrest is unresponsive and will not move, blink, or speak when you yell or tap him. He is not breathing. Often a bystander will mistake gasping for breathing, which leads to the victim not receiving the CPR they need. Remember, occasional gasps are not breathing. If you find someone down and not moving, or see someone drop, check the scene, then check the person. When you arrive at the person's side, check for response.
Are you okay? Are you okay?
If there's no response, yell for help.
Call 911. Go get the AED.
If you're alone, call 911 and get the AED yourself. Check if the person is breathing. Scan the face and chest for 5 to 10 seconds. If there's no breathing or only gasping, begin CPR. Give cycles of 30 compressions followed by 2 breaths.
4, 5.
Remember to push hard, push fast, and avoid leaning on the chest. Return to compressions quickly after giving breaths. When giving rescue breaths, if you don't see the chest rise, reopen the airway and try to give 1 more breath. then resume compressions. Now it's time to practice adult CPR on a mannequin.